The thing is, there has to be a change in the way we all look at the world. People take the word tax taker as a pejorative, as an insult, but to me, it's a definition. Are you putting more into the system, or are you taking out more than you're putting in? You're one or the other. Either you're putting in more than you're taking out, or you're taking out more than you're putting in. And then if you look at the trajectory of your life, on the whole, are you going to take out a lot more than you're putting in? Most people are going to take out a lot more than they put in once you get to Medicare, Medicaid land in old age. I mean, I've seen it up close now. It's ridiculously, unbelievably expensive.
Can we all do that, though? What I'm saying is if you're going to call the elderly who get all that medical care tax takers, aren't we all going to be in that category eventually? Because that stuff costs a lot.
That's why we're going to go bankrupt.
Who's going to save millions of dollars for their health care needs in their late age?
One of my girlfriends who's my age, so this was a couple of years ago, she's 30 years old, she had strep throat, and I said she didn't have health insurance at the time. I said, well, why don't you go to one of those clinics or something? She says, well, I don't want to be a drain on my economy.
No.
Well, that's a good attitude there. Live with the strep throat, then.
Medication.
You know, the thing is, everyone wants to make it an ideological issue, but it's not. I keep saying this. It's a math issue. Imagine we all had this dream that when we turn 80 years old, we are all entitled to our own private plane and a fleet of helicopters and a fleet of luxury cars. Well, that's what we're asking for in healthcare terms. We're asking for premium, elite, top-shelf medical care indefinitely. All of it, all the time. Whatever the wealthiest people are getting, we want that too. Whatever people who have the highest level of insurance are getting, we all want that. Well, we can't.
Well, but eventually it becomes ideological because in order to sustain all that you've just described, you're going to have to redistribute income. You're going to have to grab tax money from the taxpayers, more of it, to support all the tax takers. You're going to have to.
Look. Otherwise,
it's going to blow up like grease, and it's starting to blow up with this fiscal cliff.
The bottom half of the country, it's been proven, are paying almost no income taxes. They aren't. Now, they're paying payroll taxes for Medicare and Social Security, but they're not paying any income taxes. The bottom half of the country is certainly going to take out way more than they're putting in. In fact, most of the top half of the country is going to take out way more than we're putting in. You have something that whoever dreamed up this plan when they started this in the 1930s and the 1960s, it was insane. It was absolutely insane. And you have one party, the Democrats, who are constantly catering to this mentality because it wins votes. People like the idea of being taken care of for life. Well, who wouldn't like that idea? And the Republicans, first of all, are hypocrites because when they get in power, they never roll anything back because they know they'll just lose a lot of votes. So even George Bush expanded the Medicare program significantly. With the prescription program, I think back in 2004, and he didn't even have a way to pay for it. So the Republicans passed it. They were running the House and the Senate at the time. So the Republican Party dramatically expanded Medicare in our lifetime with the prescription program, with no way to pay for it. So I don't believe the Republicans. I don't believe they're the party of less government. I don't believe anything they say because when they're in charge, they do the opposite. They expand benefits. Without a way to pay, you have to pay for all these benefits. Somebody has to. And you can bilk the rich 100% of all their income, and you're still going to come nowhere near filling this deficit hole. We're living in a fantasy world, an absolute childish fantasy world. All of us, everybody, from both parties. We're the silliest group of people in the. All the countries are like this now. Europe's like this. Everybody's like this. Where they're rich enough to afford a public health care system. In the poor countries, they don't have the money to indulge in this kind of fantasy. But here in the wealthy countries, we indulge in the fantasy that we could all have the greatest health care forever. It's not going to happen. You're going to see. There's going to be huge repercussions over the next 20 years or so. Huge.
How ugly is the fiscal cliff going to be for California's finances? And also, Wall Street has put out its list again of the best and worst-run states in America. And again, California's at the bottom.
John and Ken, KFI AM 640, more stimulating talk radio.